Lorraine,
Yes.
if you could talk a little bit about, you're the director of home care for St. Johnland, yet a lot of your time is spent at the assisted living program.
Oh, yeah.
Can you
It's my
talk
majority.
towards that?
Right now, 100%.
Yeah. Can you talk towards that?
Yeah, well, my main responsibility here is to service the assisted living program. So, it's mandated that you have a licensed home care service agency, that's the LICSA, who will help provide services for our residents in the ALP, such as I'm providing home health aides that are working around the clock, 7 to 3, 3 to 11, and 11 to 7, to service our residents whatever it is they need. They're going to help them with all their activities of daily living, okay? And then I'm also contracted with Kelly for Helping Hearts at Home for whatever family feels that their loved one needs a companion. Kelly's the one I'm going to be calling for that. I'm also very involved with being we are, as Paul said, a Medicaid-based program. I'm very involved with doing the assessments, the RN assessments, because I am also an RN, and Medicaid by the DOH requires a universal assessment system assessment be done prior to admission. So they get a score, and then we feel that they're appropriate enough to join our community. That's where the score will stem from. So I'm not only doing the pre-assessments for our residents when they get admitted, I'm also one of the RNs, besides my case manager, Ruby, admitting them into the assisted living program. And then it also starts with Dana Leggett, who is our social worker, who does the social assessments prior to even my RN assessment, to screen them also for the appropriateness of being able to be eligible for the program. But it's a wonderful program. I'm so glad I'm a part of it.
And Lorraine, how long does that process take from a person coming in, knocking on the door, saying they'd like to come, and you get them off?
Okay. Well, Dana, as I said, is the social worker who does the pre-assessment. They also have to screen for their Medicaid, the type of Medicaid they have. If they do have the community Medicaid already in place, the process can go quicker. It can go from Dana to me in a week, and from me back to Dana within a week. They could be getting admitted within a week to 2 weeks, depending on all the Medicaid services that are in place. If they're properly in place, they come in, an admission agreement is signed with Dana, and they pick out their room, and they move in whenever they can.
That's tremendous. And real world experience is you admitted a friend of mine into the program a couple of months ago, and the family was very thankful towards the process, the people working on the process, and it worked smoothly.
She's very happy here.
Yeah, and that was difficult, involved coming from Florida here.
Right.
It wasn't just coming from around the block here.
Exactly. I did a Zoom meeting with her for her the RN assessment, the UAS. And then she flew down with her daughter and moved in.
And if something
I should say.
the family was very thankful of the attentiveness that Paul and yourself spent to move her adequately here, and from what I hear, she's very happy here.
Yes, she is.
Very happy here. Well, that's great, Lorraine. Lorraine, let me ask you one last question. In the world of home health care, human resources is an issue. Do you have your labor force in place?
Yes.
Okay.
Yeah.
So you have enough aides, you have enough caregivers?
Right now, the staff is very sufficient.
Okay.
Our human resource department, which is the main human resources next door, is helping with that process. As an agency, we don't have our own separate human resource department. Right. Maybe as we grow. But right now, yes, I have 20 aides on hire.
That's great.
And I'm almost to full capacity, though we're not even at full capacity.
That's super. You know, last time we had the video, we talked about the mission. We talked about the assisted living program, and Mary Jean Webb, who's the CEO at that time, who's retired, talked towards the mission of Lorraine was to make sure that everything worked appropriately here and got it to 100%.
Correct.
At that point, then move into the community.
Correct.
Okay? To move into the community, and that may be happening in this year.
Yeah.
That
Well,
may happen.
30% more. Once I'm at 100, we have 100 beds.
Yeah.
right?
Yep,
So-
my next step will be moving into the community, where I'll probably have to hire more staff, more RNs, field nurses, things like that, more home health aides that work in the private homes. And we're going to be servicing Suffolk County and Nassau County. So yeah, once my mission is accomplished here, that's where I'll be heading. I'll be heading towards the community to service the community residents also.
You know, and it's quite interesting also, Lorraine, is even though we're servicing at this point mostly a Paul, the assisted living, you're maintaining everything that's required as Elixir. You got a very effective QI committee.
Oh, yeah. I have
Maybe
a
if you could
wonderful
mention that,
community.
yeah.
Yeah, I have about 12 members, and I have we're contracted with VNS for higher skilled needs such as PT and OT. I have Andrea Cowles and Linda Taylor, who's the CEO of VNS, and Andrea is the intake person. Two of them are both committee members. I have Jason Romano, who's the CFO of Therodynamics, who was the PT company. I have Al Conti, who is our compliance officer, and our CEO, Mary Jean Weber, who, as Gary mentioned, is now retired, but I'm going to invite Larry, who's our new CEO, to come join us if he's able to. And I have Paul Wasser, our ALPA, administrator,
all
and
disciplines.
all disciplines from, I have social work next door joining us. I have the dietary department. Anybody that I missed? I mean,
Lorraine, that's why St. Johnland is the place to come.
oh yeah,
For everything you just said, what you have behind you, what you offer to all the people here, that there's a feeling of safety.
yes.
Okay, Lorraine, well, before I switch to Kelly, Long Island, we were just hit over the last 2 days with the smoke alert.
Yes.
How did you deal with it? How did you guys deal with that?
As a matter of fact, it's funny you mentioned that. We just got out of a meeting, Paul and I. So we had Mr. John Duffy, who's our engineering head, come give us an in-service on what to do in a disaster situation such as we've had in the past couple of days. So we now have appropriate information for the residents at the front desk. It's some instructions on what to do if they're going to go outside. We'd suggest they wear a mask, keep their windows closed until the alert is over. We're on top of, informing our residents for safety measures and our staff
That's
along
great.
with that.